So my first question is, do you get a lot of Filipinx patients, and what is your experience with them like?
Who you want to go first?
Oh, you can go first.
Oh, for me, I think in generally speaking, they're fairly excited when they find out that their doctor is going to be Filipino as well. I haven't really been doing any clinic other than the occasional bayanihan, but I found that when I was a resident, I had a good amount of Filipino patients in my panel in my clinic.
Yeah, you picked up a lot from me.
Yeah, and I think it's a lot of them, I think, do prefer having a Filipino doctor as well. I think that's if they, most of them are immigrants, right? Like the ones that are, weren't born and raised here. They tend to pick a doctor that's also Filipino. I think it's just, I don't know. You want somebody that you can connect with, and I think that's something that all of us want in a doctor, right?
Yeah, no, I agree. I actually, because the way it's structured, I graduated from residency, and so I actually had quite a bit on my panel. And Leah, when she came on, she picked up almost all of those, I think.
Yeah, I think all of them. Yeah.
It kind of tells you that they do feel comfortable with someone who's very who looks like them and who may speak their same language. And so, and for me, it really helped me like try to relearn how to speak Tagalog again. But in general, I think patients, no matter if they're Filipino or if they're Black, if they're Latino, they do tend to respond better when they see a physician that looks like them, because again, there's that element of being relatable and knowing the experience, I think.
Yeah.
So that's what I've noticed, at least.
Okay.
Yeah, I think if you're gonna go into a specialty that's gonna be heavily clinic based, you probably will not have a problem, generating a panel like from our community.
Yeah. Because then they'll look at the names, or they'll say, oh, so and so is Filipino.
Yeah.
And they're like, oh, I want that physician. Yeah.
And it's like word of mouth as well.
Yeah.
But it doesn't apply to either of our practice, but
okay. And I guess a follow-up to that is like, because of like how you're able to connect with Filipino patients more, is like, would it be worth learning Tagalog? Because like I have no idea how to speak it. I feel really bad whenever like some Filipino says, "Oh, are you Filipino?" and they start speaking Tagalog, and they're like, "I can't speak it, sorry." And like, should I like try and like learn Tagalog?
Well, I can answer that because Leah's pretty fluent in Tagalog. So, it was just for me. I wouldn't necessarily put a lot of pressure on yourself to learn Tagalog, but just know that my own experiences when I did speak Tagalog, and when I think the connection was stronger, to be honest, particularly with the older generation, because then they felt that they could speak freely. Again, I can understand totally. It's just sometimes or most of the time I have problems with speaking. And so, I wouldn't necessarily say that you have to take a crash course in Tagalog, and they will still respond to you if you look like them, right? But I do, just based on my own experiences, when they were able to speak Tagalog and express themselves in Tagalog, I think the connection was that much stronger.
I think also just keep in mind that there are hundreds of dialects in our community, and it's not just Tagalog. Although a lot of the people that we do meet do speak Tagalog, there's a ton of other dialects that I cannot speak, but they, I think, like what Dr. Sinigayan was saying, it's the connection is there despite you not being able to speak Tagalog.
Okay.
It's
Thank you
always
so much.
nice to learn a different language, though. Not, kind of just as an aside, not even like outside of your patient encounters.
Yeah.
What
I do want to learn more.
What I could say is, I mean, as a kid, I was like really fluent because it was Tagalog only at home. And then in high school, it kind of went away. And in college, it kind of went away. But towards the end of college, it kind of came back because I started dealing with more of the Filipino community. And then when I became a physician, it actually helped out a lot more. So I had to kind of relearn the language in some ways. And it was kind of actually exciting.
Okay. All right. Thank you so much.
Hello. Sorry, I was eating lunch. But Joshua, just like a quick plug, but Bayanihan Clinic is centered around the Filipino population in Sacramento area, which Dr. Sinigayan co-founded. And we try to do Tagalog word of the day, and we have Tagalog medical interpreters now. So if you wanna join our clinic, our application runs next quarter. So just a quick plug. But I guess my question, so I'm planning to take a gap year. And so I'm planning to apply this upcoming cycle in June for med school. And I just wanted to ask like your overall experience and your process going through that. When you had to apply for med school, just the whole shebang, like how'd that feel? Like what unique experience did you had to go through personally, if you're comfortable with answering?
Go ahead, Dr.
Oh, okay, yeah. So I took 2 years off. And it was initially because of choice. Back then we could only take the MCAT twice, April or August. And I hadn't done so well the first time around. So then that kind of prompted me to take a year off. And then the second time around, I hadn't done very well either. So that made me decide to take another year off. But then it just made me realize, like, to experience the real world and actually the 2 years that I had in between was actually really formative for me, not only as kind of, in a lot of ways, I matured a lot. I also grew professionally because I had a job where professionalism mattered and where you learned how to act professional and how to be professional around colleagues. And so I would say if in those gap years you were doing something to make yourself grow, or not only as an adult, but also professionally, I think it's very beneficial, because then, and Dr. Africa could probably speak to this, because we do see, or at least I see, medical students who have gone straight through and their maturation is definitely a lot less compared to those who had a gap year or two, right? Or particularly those who didn't actually work in the middle of their years. And so from a standpoint of maturation, if you're not mature from undergrad to med school, I think it is beneficial if you want to kind of really grow professionally and as an adult. If I had the opportunity to go straight through, I don't know, I may have taken that, but it's possibly because my life path had me take these 2 years off, because it's saying that I was immature and I needed to grow. That was the reason why I ended up life through 2 years off from me. So I would say for me, it was very beneficial. Again, just to recap, initially it wasn't because I chose to, it's because of certain circumstances. But in the end, reflecting, it was actually really beneficial for me.
I did not take a gap year per se, but my path to medical school was not as straightforward as others. Just because I moved here when I was almost done with college in the Philippines, I had to retake a lot of classes here in the States because the prerequisites needed to be, the medical school prerequisites needed to be from here. They wouldn't take any prerequisites from an international school. So I had to retake a lot of classes, and we didn't really have a pre-health advisor where I started taking classes. I started at Nevada State College. It was just a small college in Las Vegas. It was very new at that time. I was like not even a year, from moving to the US at that time. So I didn't really know what the process was in terms of even getting into a university for college. So that kind of came later. And it was when I took some classes at UNLV that I met a pre-health advisor. And I kind of stuck to pretty much all the advice that he gave me. And pretty much he made a roadmap for me. And that just made me realize that I can get a degree out of all the classes that I've been taking already. So I just decided to finish that and get another bachelor's. And in the process, I did, I worked some full-time jobs as well. And I think that really added to, like what he was saying, to your world experience and your maturity. And it kind of develops your character. And it's not just you're studying and trying to get A's in all these classes, but you're actually, trying to get a feel of what the world is like. And that's something that, once you get into medical school, you're not really going to get that anymore, until obviously when you start your residency. And there is you can see the difference in the students that did carry a job. It's a market difference, obviously not knowledge wise in terms of like basic sciences, but you can definitely tell how they handle things.
And I would say I would definitely agree with that. And it was a lot of also soul searching and recommitment to medicine, because during that time, when you have other opportunities, but also made me kind of during that time strengthen my want to be in medicine. So that gap year really, because there was many opportunities during that time for me to actually get out of the thinking of going into medical school. But at the same time, during those 2 years, it really strengthened my want to go into medicine.
Yeah. And I think regarding the MCAT experience, when I took it, I also didn't do very well. But I didn't have a plan B. My plan B was still get into medical school somehow. So I still went for it. I applied that year despite the low MCAT score, low from, pretty sure it's low for everyone's standards.
I got the same score twice. So.
But, I was like, well, it doesn't matter. I'm still gonna apply. Like, let's see what happens. And I got lucky enough. And I think obviously scores are a huge thing, right? A huge factor, because that's you can't really what do you call it? Like, you can't rate and rank applicants without numbers. But also, I think that the other things that I did outside, of that number also mattered, and it kind of carried me through.
Thank you. And I guess a follow-up for me would be, I haven't looked into this yet, but does UCD Med Center hire any med scribes?
I think it's an independent.
Scribes for America.
Yeah, Scribes for America.
Okay.
Yeah.
So look into that.
Yeah.
And I do believe they are hiring.
Okay.
Yeah.
Yeah. I actually attended FAHC meeting two nights ago, and yeah, I also got confirmation from other med students that people were still hiring med scholars. So I was like, oh,
Yeah.
thank you, thankfully, because
Yeah.
I was just worried
Yeah.
about like what my other plan B would be if med scribe was like not available during the pandemic. And I guess adding on to that, what would you for students who may be taking a gap year and we don't know what the circumstances are with pandemic, how would you advise them on like getting through it and stuff?
I mean, these are unprecedented times, and I think people who are going to be applying this cycle or the next cycle inevitably will be using COVID-19 as, a reason one way or another to explain, some gaps here and there. But I think I've never been in an admissions committee, but I think if I were in one, what I would want to see is a track record, right? So this COVID-19 just started this year, but your desire or your plan to go to medical school should have started a couple years back, not just this year. So what I would want to see is that there's a track record prior to when the pandemic started, that you've already started, gearing up for that. And not to say that, it cannot be like explained by the lack of opportunities, but you should have been seeking those opportunities long before the pandemic started, especially if you're going to be applying this cycle. But you're going to have to be creative like this, like during these times in order to seek out opportunities, because a lot of them are going to be obviously probably online. If you can I think there's still volunteer opportunities. Like I know that some nursing homes, they try to, because of the need for like telemedicine and video visits with family, with the residents at nursing homes, like some of them need people to actually help the residents at nursing homes try to be kind of tech savvy. So if that's something, or I don't know, like I think shelters are still, those are not stopping because of the pandemic. Like they're still offering services. So I think you're just gonna have to be creative. But I think the most important point is that it shouldn't just we shouldn't see that you're just starting the year that you're applying. It should have been a process.
Yeah, no, I totally agree. And also along the same lines, that there shouldn't be a stop just because of COVID. Like there's a lot of other opportunities out there. You do have to seek it. Like, I'll be honest, I don't know very many during COVID right now, but they are there. For example, like my sister's house has some opportunities to volunteer in some capacity. And particularly now when there's a lot of families who are being affected because of the economic downturn. There are a lot of COVID related, they could non-health stuff, but there are opportunities out there to get involved, because health is not just looking at the actual medical practice in general, right? It could be psychosocial, other social determinants of health that you could show commitment to, because you know that this pandemic affects overall general health. So you could plug yourself into many different aspects of COVID-19. For example, like there's mobile health clinics, there's going to be a rollout of the vaccine and how to get involved with that. So there's many other ways that you can get involved and show commitment to medicine even during a pandemic.
Yeah, and I think they do take volunteers for like contact tracing.
Yeah. Oh,
that's
perfect
a big
example.
thing right now.
Yeah.
That's a big thing right now. Contact tracing, churches, shelters, kind of not really medicine related, but it shows, your commitment to being of service, which is what medicine is all about.
Yeah.
Thank you so much.
So I guess my next question is, I know you covered it a bit, but what other experiences do you have that is not necessarily medically related, helped you get into med school and helped you grow as a person?
You want to start that, Sinigayan?
Yeah.
Yeah.
So that's not medically related, and what got me into medicine. Actually, it was being of service and particularly community service that actually strengthened my want to go into medicine. I think what Dr. Africa was saying was, you know, medicine is being of service to people, and what really kind of solidified medicine for me was being of service to people, particularly with veteranos or Filipino World War II veterans. And so, you know, when I was an undergrad, I really kind of got involved with those guys and their families. And it wasn't just like doing health screenings, but actually visiting them, talking to them. At one point, we had aspirations of building a kind of um, a project where we just carry on their story so that they would be never forgotten. So that actually just being of service to those guys um, eventually solidified my want to be of service to people. And the way that I kind of justified medicine was, you know, I really like just medicine in general and just learning about medications and health. And so, and that was a service field. And so for me, that really kind of strengthened my want to go into medicine, is because I was of service to these veteranos who really needed it. And so for me, that was like everything in terms of why I went into medicine.
Yeah. I mean, for me, I have to admit that a lot of the things that I did were kind of science related because I really enjoyed it, but also I did some stuff outside it. So in terms of the non-science or medicine related, for a few years, I did volunteer to be a tutor for foster kids. So there were two kids that I kind of stuck with for a few years, tutoring them in Las Vegas. So I would go to her house, I think 2 or 3 times a week in the afternoon, and try to do tutoring for the classes that are kind of difficult for her. And so that, you know, that was kind of an ongoing thing throughout undergrad. I was a scribe for, I think, maybe 2 or 3 years as well. And that was a full-time job outside. Like I was doing that as a full-time job outside of college, you know, like working or going to school full-time as well. And I did work in a lab for money too, for money and experience. So I feel like most of the things that I did, you know, I was getting paid, except for obviously the things that I was volunteering for. And I think probably my most memorable experience as an undergrad was being involved in setting up this free clinic in Las Vegas. So I was fortunate enough to come across this doctor. Her name was Dr. Florence Jameson. She was an OB-GYN, and at that time there was no free clinics in Vegas, but this doctor was very active already, kind of volunteering her time in juvies, in kind of like just wherever she can help. And I think she, you know, was tired of just doing it outside of like an actual building, you know, so she wanted patients to actually have a place to go to. So I was pretty heavily involved in that. Like we were actually doing like some door-to-door activities, because that community where the clinic was gonna be, you know, obviously if it's a residential area, like the homeowners kind of surrounding that area would not be as willing to have a free clinic, you know, near their home, for some, you know, kind of security reasons, I guess. So a lot of lobbying, a lot of, trying to do door to door and educating the residents, the people around it, getting some funding. So like a lot of like the behind the scenes work and getting the free clinic up and running.
Yeah, and the other thing that I did that remembering back actually was going along that service. I was actually lobbying for Filipino studies and again the veteranos and stuff like that. So I actually got to go to the Capitol and speak to representatives. And so that actually also really helped in terms of learning how to advocate for folks. And that eventually translated to advocating for patients. So I think there's a lot of avenues that that I think life skills like advocacy and service that you learn that can easily translate into medicine. And so that's the thing that I think if you're asking like if it helped you kind of shape how you are in medicine, those are experiences that definitely helped me.
All right, thank you so much.
Hello. Oh, sorry. Do you have a question also? Oh, okay. Sorry again. But sorry, Dr. Sinigayan. I just remembered. You gave out an advice to Grishelle. I don't know if you remember her. You gave out
Yeah,
an advice to Grishelle.
Oh, where is she now?
Oh, she's in Mabuhay Health Clinic now. So she's volunteering
San Francisco,
there.
yeah.
Oh.
Yeah, so she's taking a gap year as well. I think both of us are gonna take the MCAT hopefully next year. So crossing fingers. But yeah, you gave out an advice to Grishelle last year or 2 years ago with regards to an interview, and you gave her like these 3 like important factors that like determine basically your purpose, I guess.
Oh.
Yeah, and I wanted to ask if you could like say it again, because to be honest, I kind of forgot it, but I also thought it was really great at the time, so I thought if you could mention it again.
No, someone had told me this, and it was advice from I forget who, but they always when I was going through just any interview in general, particularly with the med school interviews, to really focus on 3 or 4, the less the better, qualities about yourself that are very indicative and characteristic of you, and make sure that with each answer that you give reflects those qualities. For example, when I was going through my med school interviews and rehearsing questions, I would always go back to three qualities that I thought was very strong and was very characteristic of me, which was service, particularly service to my community, my dedication to the community, so community, and then also my passion to serving the community, so passionate. So the 3 qualities that I tried to always get across was service, community, and passion. And so that's one thing that I always try to kind of hopefully carry out and convey in the answers that I had provided. So that was the advice that I think I gave to her. So if you're like, it doesn't have to be those 3, but it could be anything that really truly characterizes you, and so that your interviewer gets a really good sense of who you are as a person.
Thank you, Dr. Sinigayan. Yeah, that was I think that was the advice that I recalled in the past. But yeah, thank you again,
welcome.
and Alyssa, you can ask your question. Sorry about that.
But I have a question. I was just going in. But yeah, do you guys have any other questions for Dr. Sinigayan and Dr. Africa?
Along the lines of interviews, there's a lot of websites, that has a list of most asked questions during medical school interviews, and I highly recommend just rehearsing. You don't want to sound like a robot when you answer questions, but at the same time, it's nice to have a vague idea of what questions might come your way, so that you're not, some of them you can easily prepare for, like the answers. Most of, like, there's going to be a lot of questions that you are going to be caught by surprise with, but at least some questions are going to be very common throughout all the interviews, and it's nice to rehearse those.
You guys have any other questions? Joshua, did you have a question?
Oh yeah, I have a few other questions. So a little looking less at like med school and other stuff. Looking more like just patient care in general. What kind of patients do you guys usually work with, and how is it?
It's going to be skewed.
Yeah. Yeah. You could explain what we do, Dr. Africa.
So Dr. Sinigayan and I are hospitalists, and that means that we specialize in providing care to patients who are in the hospital. So higher acuity, sicker patients compared to the patients that you would see in clinic, for example. I think being at UC Davis Medical Center, like the patient population here is different from, let's say, somebody or the demographics that you would find at Kaiser or a private hospital. So we do see a lot of uninsured patients, and we do see a lot of kind of how do you say it, less fortunate people in our patient population. Not to say that we don't have that's all the patients that we see, but you definitely get more of that demographic here. Yeah, I don't. Well, so the question is like, what kinds of patients do we see, or what kind of what is the?
I guess like
what did you want to know more?
Question is like, oh, just what kind of patients do you usually get in general, and like how you interact with them? And, like, you said that there's like more sick patients that you tend to work with. Like, how do you go through that like process of just dealing with it, and like making sure that they know that you're good to work with them? Are you guys getting like what I'm trying to say?
Yeah.
I'm sorry if like it sounds a little weird.
Yeah, just piggybacking on what Dr. Africa says, it really depends on your specialty. And we as hospitalists do deal with patients that are sicker and that sometimes can't really talk to us. And so, but there are probably half and half where we're able to talk to them. And so we can develop a connection. But for example, if you're an outpatient doctor who has a clinic, that's a little bit different, because those are patients that can walk in your clinic technically, and you could actually speak to them and talk to them, versus like my wife who's in OB-GYN, her patient population is either young and pregnant, or older that have a lot of gynecological issues, or just generally healthier in general. So it really depends on the specialty that you go into. Whereas me and Dr. Africa, we really deal with sick patients compared to my wife is an OB-GYN, and she's particularly specializes in adolescent GYN. So she sees a lot more younger kids or younger women who have potentially gynecological issues. So I would say it really just depends on what specialty you're in. And then, like for me, I just really like internal medicine, um, and and thinking about complex things. And I found myself to be a problem solver. And so that's why I really like internal medicine. And that's why I gravitated towards the hospital, because I tend to like sicker patients and to think about patients a lot more.
Yeah, and because we deal with sicker patients and generally older patients, we also deal with a lot more family interaction, because they're here in the hospital, and sick. You know, a lot of these people cannot really relay to their families what's going on in the hospital and what's going on with their health. It's a little bit complex for them to explain. So we, as their doctors here in the hospital, coordinate a lot of their care with their caregivers at home, their families, in order for them to understand what's what's happening. A lot of kind of advance, like educating the families in advance before the patients go home, to know what to anticipate at home and what kind of care they'll be needing once they get discharged from the hospital. Which is different from, I think, when you're in clinic. You're usually just dealing with, the patient because they're well enough to be there and see you and talk to you.
And I guess a follow-up question to that. Second year undergrad, I know I still have like a while to go. What steps can I take to become better with patient and family interactions? Just because like I don't feel like I'm ready to like have that major responsibility now to like interact with the patient and family as well, and I would love to like improve on that aspect.
I think, like what we were saying earlier, having an experience, not necessarily have to be like in the medical field, just like having a job or having any kind of volunteer experiences that would enable you to be out there and interact. Because interaction, whether or not you're talking to a patient, like there's like a basic, right, like a kind of a, what do you call that, like a basic etiquette, or that you don't get if you're just always studying, right?
Yeah.
Like if you're always just studying and just reading your books at home or in the library, like that's definitely not going to get you anywhere in terms of patient interaction. So I think any kind of volunteer experience or paid jobs, that really helps. It doesn't matter if you're dealing with a patient or not, but the mere fact that you're out there and interacting with people, I think will help you.
Yeah, I mean, that's the key, is because me and Dr. Africa's job every day is interacting with people.
Mm-hmm.
And interacting people is so much more than just, talking. It's like picking up certain like cues from their body language, and
Mm-hmm.
picking up certain cues in terms of how they are talking, even looking at their eyes and just noticing, like, is it getting bigger, or is it having this confused look? So yeah, no, it's very early to think about how to improve your interactions and how with patient care, like. But I think what in general, I totally agree with Dr. Africa in that just being out there and just talking to folks, and more than just being on FaceTime, right? Is gives you life experience in terms of how to deal and interact with folks, even if like, because I mean I was an introvert to be honest.
Mm-hmm.
I know, Dr. Africa, that may seem weird, but
It's hard to believe.
hard to believe. But what really helped me was just putting myself out there, and even if I mess up with speaking to someone or something like that, you learn from it, right? If you don't mess up, how do you learn? So there's certain situations that I remember in my head, I'm like, oh, I shouldn't have done that. I'll do better next time. But the only way to do that is to actually put yourself out there and actually interact with folks, I think. So just interacting with folks, and rather than just staying home studying, being on your phone or whatever, or being in this Zoom, it's it's
different.
different.
Yeah.
But being out there is, I think, is the key to interacting with people, because then that's what Dr. Africa and I do every day, is interact with folks.
And the basics of patient interaction is the same basics in any human interaction, right?
Yeah, totally.
You know, you have to learn how to respect. It's like a give and take. You know, listen, give the other party a chance to be heard. It's the same. Like no matter what kind of interaction you're in.
Yep.
Thank you so much.
So this is kind of related to what Joshua's been like asking y'all right now, but for me, so I'm on Bainihan Clinic board this year, and with that comes with a lot more administrative work. And I've actually kind of grown to really enjoy the work because it puts you in another perspective with medicine, right? Because one thing that we really emphasize in our clinic is that each role has just amount and equally important purpose in work, and we all need to be well connected together in order to work efficiently together. And so with that, I was wondering, like, what are the ways that like healthcare professionals, especially doctors, can still tie into that kind of administrative side, like trying to also focus on, like, you know, preferred languages, checking on insurance policies, like pharmacies, et cetera, because for me, I know I spoke to both of y'all before that I have an interest in geriatrics and internal medicine, and so I'm sort of leaning towards being a hospitalist. And I feel like in clinic, doctors in my knowledge right now, as of now, I feel like doctors have like more control or have more say with the administrative side with our clinic, at least, but I'm not sure how much say they have in terms of being in a hospital system, because it's more institutionalized and it's more, you know, there's more actual like profession. I don't know if I'm right.
Dr. Sinigayan is the best person
like...
to answer this. I mean, you couldn't have picked a better person to ask this question to than Dr. Sinigayan.
Oh man.
Oh yeah, you're like internal vice, like something.
Let me try to understand the question again. Is it mainly to, like, how is it administratively from a medicine standpoint, or how's the working relationship between admin and the physicians in a hospital setting versus how it is in a clinic setting? Is that what you're trying to ask?
Yeah, I guess the latter part, because I really want to become a doctor, but at the same time still keep into like close ties with the administrative side of medicine, you know, like making sure I follow up with my patients personally, and I want to make sure that they're getting the best possible services outside of like medicine wise and health related wise, just more like administrative work and stuff. And so yeah, I wanna keep that in my career path moving forward.
Yeah. So it's a good question, and it's a pretty loaded question, actually. And it also, it sounds like it also depends on what your view of administrative means. There could, in terms of administrative, there's a lot of like, if you're looking at the clinic specifically, administrative side could mean, like, you know, following up on an inbox, or making sure you're following up on labs on a patient, stuff like that. And I'll be honest, from a physician's perspective, it can get overwhelming. And I think that's where most of the burnout is with physicians, is the administrative side can get very burdensome, just because there's this thing in what we say in medicine is, are you practicing to the level of your degree? And because of certain things that were done out of our control, there is a lot of administrative responsibilities that physicians have. Unfortunately, that falls on the physician. That is not necessarily a part of the scope of being a physician, which means diagnosing and treating and using medicines or doing surgery, but it falls into like doing paperwork for the DMV or for the government or stuff like that. And so that can get very overwhelming. And there can be help in terms of people doing that administrative side, because what you'll find out is a lot of times the joy of medicine is actually the interactions with patients and the thinking about patients and how to get them better or how to treat them or what to diagnose. Whereas the side that tends to not be so exciting is dealing with the administrative burden of paperwork, for lack of a better term, or trying to figure out kind of the social in routes that you need to do in order to provide some care that you think your patient needs. And depending on where you work, and depending on your administrative staff of coordinators, social workers, more or less could be better or not as good. So what I would say is there's certain systems that are better than others, and it just depends on where you work, right? Now there's another administrative side, which is more towards managerial and managing a clinic and stuff like that. And the reason why Leo is laughing is because I'm the assistant chief of our group, but I also do a lot of administrative stuff on the health system side. And a lot of that is dealing with initiatives that deal with patient care and systems to improve patient care and to improve the quality of care that we provide. And again, it's a different aspect of medicine because not only are you just looking at an individual, you're looking at how a whole system provides care and how to make sure that we keep high quality of care as a whole rather than just as an individual physician. And in some ways, it's actually pretty exciting because then you get to see like a whole population get better because of the initiatives and that you implement amongst all the physicians within the health system. But the caveat to that is people don't often like change, and change can be hard. And so when you get into someone who has a certain way of thinking, a certain way of doing things, and you ask them to change it, that's where it becomes very difficult, because then from an individual level, it may not matter all that much. But if you have like 10, 20, 100 individuals that don't do that specific initiative, then it becomes a big system problem. And so it could be very rewarding, but it also be a big headache. So most physicians will say, though, that they wish that what brings them joy is actually the medicine, the thinking and the interactions of taking care of people. Yeah. Whereas a lot of the headache is on the administrative side.
Yeah. Kind of to piggyback on something that you said about, all these other allied health professions. I think I haven't been a practicing doctor for very long, but what I realize is that it doesn't matter how good of an individual doctor you are, you need the help of other people in order to provide the best possible care. And as a hospitalist, that involves your social worker, that involves your physical therapist, that involves your case manager, that involves your pharmacist, all these people that provide the adjunct care are very crucial also in providing wellness to the patient, and it's not just like the medicines that you prescribe, it's not just the diagnosis that you make, it's also the care that's delivered by it's like a multidisciplinary approach, right? It's the care delivered by everybody involved in that patient, not just you.
Thank you so much. Sorry if it was too loaded of a question.
No, it's totally fine.
I know it's almost 1 o'clock, but if y'all still had some time, I wanted to follow up another question that I actually asked y'all 1 to 2 years ago, back when we both like we started having y'all as our advisors. So my question was like about the mental health in terms of, being a physician. So I don't know if it was you, Dr. Sinigayan, or Dr. Africa, but you said something about like the med center trying to work on like trying to establish some kind of mental health, kind of wellness for the physicians and stuff. And I just wanted to follow up on that because as you know, a lot of students, they're very well aware of burnout in college, and especially when you're pre-health or pre-med, it takes a
I didn't even
lot.
know what
It
that was
takes,
in college, to be honest.
Yeah.
or
Yeah.
like there was no term for it yet, right? But then now, nowadays, a lot of students really understand and fully acknowledge the term burnout now and the concept of it. And so I'm wondering is like, how do you think hospitals or clinics or healthcare in general is trying to work on that in terms of the mental health for their healthcare professionals as well? Because it's just as important that the wellness of the doctors and other health professions are well and like all good.
I think one of the most important aspects of that is awareness, like generating awareness about burnout and generating awareness that there are services that are available and generating awareness that it exists, right? Is key. Because like you said, like back in the day, we don't like, these are not entities that are really well talked about or acknowledged,
Especially being Filipino.
yeah, so acknowledging that it's real is the first step. And I think as in general, like the healthcare, well, I think has done over last couple of years have done a better job in generating that kind of awareness in like a systems wide way. Yeah. But in an individual, I think I don't know, for at least for me personally, having a good core, with your kind of your own network, family, whether it be family or friends, having a solid core of people that are with you along the way is very important.
Yeah, I think in general, some industries do it better than others. I know in the health industry, it's been kind of lagging, but more and more, and what you'll see is by the time you guys become doctors, if you guys choose that field, or any health field in general, I think is burnout will be addressed more and more, and they will hopefully help show employees on what the signs of burnout are. And I'm sure you're getting that in college now, and hopefully, at least I know in our med school here, that is, the students are actually given resources to recognize burnout. And we as an institution are getting better to provide the physicians on the tools to recognize burnout, and also the resources out there, provide the resources out there for burnout. For example, like we have a physician's lounge, at least in our group, and hopefully you think this is truly try to address a good work-life balance, to make sure that the schedule's okay, and to make sure that we encourage people to take time off if they need it. And so I think by the time you guys are out in the workforce, it'll be a lot better than where me and Dr. Africa are. So I think it's being addressed more, because what they're finding, at least in the studies, are it's very expensive if people in general, if your workforce is burnt out, and the quality of care is not as good. And so I think systems are really, health systems in general are really focusing on making sure that their employees are not burned out.
Mm-hmm. Yeah.
With that said, will burnout disappear just because of that? No. I mean, I think it's also an individual level where you yourself have to recognize that. And I know for me, I really ignore it because I just,
Yeah.
I'm in the thought of, you know, my parents and we're very similar also. And so we never talked about feelings. And so,
Yeah.
and that's how, unfortunately, that's how I am, but hopefully I'm not projecting that to the employees I work for
No.
or my kids, you know?
Yeah. And also it's kind of the nature. It's kind of part of medicine somehow, you know, like the competitive nature of it and the always striving to be you know, the best version of yourself, and hopefully you know, like the best in whatever you do. It that in and of itself causes an internal struggle all the time, leading to burnout. So I think my job has done a pretty good job in terms of trying to um, get to the factors that lead to burnout and addressing that, kind of like a root cause, you know, like getting to the root causes.
Thank you so much again for answering my questions.